For the audience, you need to silence your cell phones so when the commissioners come up, we can actually hear the questions and the answers from the testimony that will be given on all the various things that come before us. Also, we have Councillor Stevens is joining us. Councillor Stevens via phone. Councillor Stevens, can you hear us okay?
Yes, I can, Governor. Thank you.
Great. Thank you so much, Janet. Councillor Stevens, could you begin by just giving us, again, reaffirming your name, location, and if anyone is with you?
Good morning, everyone. This is Executive Councillor Stevens calling from her home office in Rye, and I am alone.
Great. Thank you, Councillor. And then what we'll do, just to go over the formality, after each vote, I'll just kind of come back to you, Councillor Stevens, on a yay or nay, if that's okay.
Thank you.
With that, Councillor Wilkinson, thank you for hosting us this morning, and General Michaelides hosting us this morning over at the National Guard. I thought that was a great presentation for the new Heritage Center they have over there. But I'll kick it over to you for a reading in the pledge.
Thank you. And again, thank you, General Michaelides, for hosting us, and for any of you that haven't seen the new Heritage Center, it's really wonderful and a great opportunity to study some of our history. So this being Black History Month, I am reciting the lyrics from the song Lift Every Voice and Sing, written by James Weldon Johnson in celebration of Lincoln's birthday in 1900. It recognizes both the struggles and the joy of the Black experience in America. Lift every voice and sing, till earth and heaven ring. Ring with the harmonies of liberty. Let our rejoicing rise, high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing a song full of the hope that the present has brought us. Facing the rising sun of our new day begun, let us march on till victory is won. Stony the road we trod, bitter the hastening rod, felt in the days when hope unborn had died. Yet with a steady beat, have not our weary feet come to the place for which our fathers sighed. We have come over a way that with tears had been watered. We have come treading our path through the blood of the slaughtered, out of the gloomy past, till we now stand at last, where the white gleam of our bright star is cast. God of our weary years, God of our silent tears, Thou who hast brought us far on the way, Thou who hast by Thy might led us into the light. Keep us forever in the path, we pray, lest our feet stray from the places, our God, where we met Thee, lest our hearts, drunk with the wine of the world, we forget Thee. Shadowed beneath Thy hand, may we forever stand, true to our God, true to our native land. Thank you. Would you join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Now we're pleased today to bring back a tradition to the Council of sharing some music with the Council. And today we have with us Concord High School student Kai Gata, his instructor Ellen Nordstrom from the Concord Community School of Music, and he's also joined by his mom Julie. And Kai is going to share with us 3 pieces that he has performed. He is very active in community theater and has a wonderful talent, and we're very glad to have you with us today, Kai.
Once again, thank you guys so much for having me here. My first piece is going to be a cut from a song that I recently performed called Serious from Legally Blonde. We both know why we're here. I see it in your eyes. I guess it calms my fear to know it's not a surprise. I thought one look at you, looking like a dream come true, would leave me speechless like you always do. But not right away, and we've got some plans to make. Let's take some action, baby. So baby, give me your hand. I've got some dreams to make true. I've got the future I'll play. It's time to get serious. Time to get serious with you. And my second selection is going to be an a cappella audition cut from the song Wait For It from Hamilton. What is it like in his shoes? Hamilton doesn't hesitate. He exhibits no restraint. Takes and he takes and he takes and he keeps winning anyway. Changes the game, plays and he raises the stakes, and if there's a reason he seems to thrive and so few survive, and God bless it, I'm willing to wait for it. I'm willing to wait for it. Life doesn't discriminate between the sinners and the saints. It takes and it takes and it takes. We rise and we fall, and there's a reason I'm still alive when so many have died. Then I'm willing to wait for it. Wait for it. Wait for it. And my final selection of the morning is At Last I See the Light from Tangled. All those days chasing down the days, all those years living in a blur, all that time never truly seeing things the way they were. Now she's here, shining in the starlight. Now she's here, suddenly I know. If she's here, it's crystal clear, I'm where I'm meant to go. And as I see the light, it's like the fog is lifted. And as I see the light, it's like the sky is new, and it's warm and real and bright, and the world is somehow shifting. All at once, everything is different now that I see you. Now that I see you.
Would you guys like to join us in a photo? If you want. Wait, you can do whatever you want. Oh, yeah. You said so. All right, let's have everyone right here first. If you want. Good, would the council like to join us? Come on up. Shuffle one step over this way. There we go. Perfect. Right here first.
Thank you guys so much.
Thank you.
If I have the courage to come over, I will let you know. Okay, it's great that we're getting our performances back. It has been like literally 2 years. I think that's the first performance in about 2 years, which is pretty incredible. So obviously a lot more to come, and it is a great way to kick off anything happening in the State House. It kind of puts everyone in the positive mood. We have one more commendation before we get our general meeting started today, to recognize really an individual. I know he's been doing some commendations with his retirement, and I always put retirement in quotes because I never believe anyone's going to retire around Concord. Because if you're here and you're working in Concord in whatever pathway, whether it as an elected official or as someone in the nonprofit world or whatever it might be, there's always a passion of service, which is really great. So the individual we really want to highlight today, who's been incredibly instrumental in transforming our mental health system and really helping us in terms of Commissioner Chibonnet and myself and our teams at Health and Human Services and working with the other nonprofits, really grab one of the toughest problems that our nation is facing and try to put some innovative ideas, not just more money, but innovative ideas and real solutions, and try to focus on the individual as we do so much in New Hampshire. A lot of you know him. He's been up here before for a variety of things. Mr. Ken Norton. Come on up. Excellent. No, thank you. So I'm going to joke on you a little bit, so you just take it. A lot of folks have heard me tell a lot of the stories of when we first got here and really diving into the crisis of mental health. And one thing about when you deal with issues of mental health, whether it's with adults, whether it's with kids, whether it's with more of the elderly, the geriatric mental health community, the needs at New Hampshire Hospital, the needs in the community, the needs in a rural area versus the needs in a larger city like Manchester, it is so different. It really is different, which is why we try to really take and focus on the individual. That's hard too, right, to create all those different opportunities. We still got a long way to go, there's no doubt about it. What you think you know about mental health, trust me, you don't. You become governor and you walk in the door and Ken comes in, I think in January, like maybe in the first month or so I met with him, and I realized, holy cow, this is a lot bigger than any of us even imagined. And it wasn't I think what I really appreciate about not just Ken, but the entire staff, by the way, at NAMI, I don't know if they're here. Hey, how are you guys? There you are. The entire staff was really, okay, here's some possibilities, here's the challenges, and not every challenge can be solved immediately, unfortunately. You want it to solve it immediately. Some more infrastructure needs, workforce needs. I think that's going to be one of our biggest challenges going forward. But the approach is what I want to get at. The approach that you and your leadership at NAMI had, bringing a lot of the other nonprofits that work with NAMI in this field together and having a collaborative approach, putting everybody at the table together, and just putting all the ideas on the table and then kind of prioritizing. There's the low-hanging fruit. What are the longer commissions? What are the barriers? Is it legislative? Is it funding? It could be a variety of things. So we're going to keep kind of taking those challenges head on. But with the tone you set early on in 2017 and 2018 for my administration, and I would never speak for Senator Hassan, but I think the same thing for Senator Hassan and Governor Lynch as well. Your leadership with all the administrations through this building has just been phenomenal. And we just can't thank you enough. All right, you bet. So I have an official commendation to recognize Ken Norton. Whereas Ken Norton began his career at the National Alliance on Mental Illness, known as NAMI, in New Hampshire in 2003 and served as the executive director from 2011 to 2021. And whereas Ken worked diligently to grow NAMI New Hampshire, consistently increasing the staff and budget over the last 10 years to ensure more people could receive critical mental health and suicide prevention services. And whereas he has been committed to improving the mental health system in New Hampshire and is a strong advocate for people impacted by mental health challenges and their families, and whereas he has also served on several boards, including the Law Enforcement Accountability, Community and Transparency Commission, the State Disaster Medical Advisory Committee, and the School Safety Task Force. And whereas Ken's compassion, advocacy, and knowledge has been instrumental in creating long-lasting and beneficial changes to mental health and suicide prevention in the Granite State, and his contributions will be greatly missed. Now, therefore, I, Christopher T. Sununu, Governor of the State of New Hampshire, do hereby commend Ken Norton for his tireless advocacy and service to the Granite State. Thank you. Okay, great. I know, that's what I figured.
First, thank you very much. And I've not used the retired word, I've used the rewired word. So, and I accept this on behalf of not only New Hampshire and all people in the state who have been impacted by mental illness and suicide. And on behalf of those folks, I want to thank you, Governor, for your leadership in really transforming the mental health system. And you and your team, you have put people in leadership roles, Commissioner Chevenet, Commissioner Quinn, Commissioner Hanks, General Fremeller, Commissioner Nicolopoulos, General Nicolaides, Commissioner Adablu. Who am I missing? Sorry. Who all have been incredibly strong in mental health. And it's through that collective leadership with the nonprofit community that we've really been able to make significant gains in the state. And really appreciate that. I appreciate the bipartisan support that the legislature has brought towards these issues, and to you, our executive counselors, who have looked at the contracts that come before you and helped move the system forward. And it's all of us together that have done this. That said, I will say that yesterday there were 23 adults and 8 children sitting in emergency rooms waiting for care, and they are the tip of the iceberg. And as you said, Governor, these problems were long-standing and building up. They're not solved overnight. And I would just encourage all of us to continue to commit towards moving the 10-year plan forward. And thank you all so much.
Thank you. You haven't changed your supplement? No.
And this is Susan Stearns, who is our new director, our former deputy.
Excellent. Okay, so moving forward, I'll officially call this meeting of the Governor and Council to order. I'll begin by asking for a motion to approve the meeting minutes from our January 26, 2022 Executive Council meeting.
Second.
Is there any discussion or questions or changes to the meeting minutes? Okay, hearing none, all in favor of approval of the minutes as presented, please signify by saying aye. Aye. Any opposed?
Aye.
Thank you. Any opposed? And with that, with the ayes the meeting minutes are approved. Next, from the Office of the Secretary of State, we have our civil commissions. Could I please have a motion to confirm the list of civil commissions?
Second.
Any discussion? Oh, sorry. We have a motion and a second. All in favor of the list of civil commissions, please signify by saying aye. Aye. Any opposed?
Aye.
Thank you, Councilor Stevens. So with that, the list of civil commissions is approved. Are there any names to be placed on the list of civil commissions? Councilor Wheeler?
Megan Schultz.
Any additional names to be, Councilor Kennedy?
Thank you, Governor. Jada Burrows of Milton is the Justice of the Peace. And this was really notary as well.
The JP and the notary. Are there additional names to be placed on the list? Okay. Hearing none, the matter of the civil commissions is concluded. We have a few resignations to accept today. So I'll begin by asking, could I please have a motion to accept the resignation of Dana Pierce from the Board of Barbering, Cosmetology, and Aesthetics?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed?
Aye.
Thank you, Councilor. With that, Dana's resignation is accepted. From the Board of Nursing, could I please have a motion to accept the resignation of Tracy Collins of Rochester?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
With that, any opposed? With that, Ms. Cron's resignation is accepted. From the Compensation Appeals Board, could I have a motion to accept the resignation of Ann Eaton of Concord?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, Ann's resignation is accepted. From the Fire Standards and Training Commission, could I have a motion to accept the resignation of Jason Green of Kensington?
So moved.
Second.
We have a motion and second. Any discussion? Hearing none, all in favor signify by saying aye. Councilor Stevens?
Aye.
Thank you. Any opposed? With that, Jason's resignation is accepted. From the Physical Therapy Governing Board, could I have a motion to accept the resignation of Joseph Shanley of Nottingham?
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? With that, Mr. Shanley's resignation is accepted. From the Volunteer New Hampshire Board of Directors, could I have a motion to accept the resignation of Colby Chappett of Concord?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, the resignation is accepted. And finally, from the Water Council, could I have a motion to accept the resignation of Malcolm Butler of Hillsborough?
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? With that, Malcolm Butler's resignation is accepted, and that concludes the resignations for today. So moving on, we do have some confirmations to hopefully move forward. Could I begin by having a motion to confirm William Cass of Laconia as the Assistant Commissioner for the Department of Transportation?
So moved. Second.
Any discussion?
Second.
Thank you. Any discussion? Councilor Kent.
Well, Deputy Commissioner Cass of Laconia is one of my constituents, but I really consider him one of the all-stars in state government. Wonderful demeanor, solves complex problems, works with the public, goes to public hearings, and I've never seen the guy get angry. I want to see him get angry one time, but I've never seen it. And he's got great engineering experience, and just interpersonal skills are just outstanding. So what a great job he does for Steve. And I think he's been 35 years plus service. We'll let it out.
Without a doubt. Further discussion? He's here today, so
Oh, yeah. Says those nice words.
exciting. Okay. All in favor of Mr. Cass, please signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, Bill is reappointed. Could I have a motion to confirm Raylene Dell Dover as the Deputy Commissioner for the Banking Department?
So moved.
Second.
Any discussion?
Second.
Oh, thank you. Any? Okay, hearing none, all in favor signify by saying aye.
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 Thank you. Any opposed? Okay, with that, Raylene is confirmed. Could I please have a motion to confirm John Marasco of Cooksit as the Director of the Division of Motor Vehicles, Department of Safety?
So moved.
Second.
Thank you. Any discussion? Yeah,
I
Councilman
just wanted to say a couple words in favor of Joan Marasco. We've been working together on a couple of projects over the last year. Very helpful, very open to new ideas and solutions and procedures. And so I wholeheartedly support Joan Marasco for this position.
Further discussion? Okay. Hearing none, all in favor, please signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, John Marasco is approved. Could I please have a motion to confirm Mark Fournier of Exeter to the New Hampshire Vaccine Association?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed?
Aye.
Thank you. Any opposed? With that, Mark Fournier is confirmed. Could I please have a motion to confirm Vivian Beer of Manchester to the New Hampshire State Council on the Arts?
So moved. Second.
Any discussion? Hearing none, all in favor, please signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, Ms. Beer is confirmed. Could I please have a motion to confirm Madeline Rosica of Pelham to the New Hampshire Veterans Home Board of Managers?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, Madeline is confirmed. Could I please have a motion to confirm Brian Paquette of New Boston to the Public Employee Labor Relations Board?
So moved.
Second.
Second.
Thank you. Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? With that, Brian is confirmed. Could I have a motion to confirm William Flanders of Hampton to the Speech Language Pathology and Hearing Care Provider Governing Board?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed?
Aye.
And with that, Mr. Flanders is confirmed. Could I please have a motion to confirm Meredith Bergeron of Canaan to the Speech Language Pathology and Hearing Care Provider Governing Board?
So moved.
Second.
Second.
Any discussion?
Governor?
Yes, Councilor Stevens, please.
Thank you. I'd like to applaud you for recommending and nominating Mr. Flanders or Dr. Flanders and Ms. Bergeron. This board has not been able to meet for 6 consecutive meetings because of a quorum matter, and both of these professionals with great insight and enthusiasm are stepping up during a critical period. So these are great candidates, and I also thank them for stepping up.
Thank you, Councilor. Any further discussion? Okay. Hearing none, all in favor, please signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. And with that, Meredith Bergeron, any opposed? Sorry. Yep, with that, Meredith is confirmed. And could I please have a motion to confirm Richard Robert of Deerfield to the State Historical Resources Council?
So moved.
Second.
Any discussion? Hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? With that, Richard is confirmed. That does conclude our confirmations for today. Moving on, we do have a list of nominations to read into the record. As the acting director of the Division of Economic Development for the Department of Business and Economic Affairs, I nominate Tina Chasm of Northfield. To the Board of Architects, I nominate Michael McEwen of Londonderry. To the Board of Landscape Architects, I nominate Gregory Rusnicka of North Sutton. To the Board of Licensing for Alcohol and Other Drug Use Professionals, I nominate Joni O'Brien of East Wakefield. To the Community College System of New Hampshire Board of Trustees, I nominate Greg Eastman of Littleton. To the Compensation Appeals Board, I nominate Timothy Wheelock of Portsmouth, Roger Savini of Dover, and Edward Stewart of Manchester. As the Director of the Division of Administration for the Department of Safety, I nominate Steve Lavoie of Allenstown. As the Director of the Division of State Police for the Department of Safety, I nominate Nathan Noyes of New Boston. To the Executive Branch Ethics Committee, I nominate Sam Martin of Dover. As a Justice to the New Hampshire Circuit Court, I nominate Brian Shaughnessy of Bedford. And as a Justice to the New Hampshire Superior Court, I nominate Jackie Smith of Sharon. To the New Hampshire Veterans Home Board of Managers, I nominate Paul Lloyd of Concord. To the Physical Therapy Governing Board, I nominate Robert Warden of Atkinson. And to the State Board of Auctioneers, I nominate Frank Eaton of Concord. And that concludes the nominations for today. So moving on, we have our consent calendar. Can I begin by asking for a motion to adopt the consent calendar agenda?
So moved.
Second.
Second.
Thank you. We have a motion and a second. Is there any discussion or request to remove specific items for additional discussion? Okay, hearing none, no requests. All in favor of the consent calendar agenda as presented, please signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? And with that, the consent calendar is approved. So moving on to our regular agenda, our first item, item number 6, is from the Business Finance Authority. So I'll begin by asking for a motion to adopt agenda item 6.
So moved.
So moved.
Second.
So a motion and a second, thank you. I'll ask Mr. Q. Wallace to come on up. And again, as this is an item from the Business Finance Authority, it is open to a public hearing. So following the initial round of questions and answers from the Executive Council, we will open it up for the public hearing. If anybody in the audience wishes to speak specifically on this item, they'll have the opportunity to do so. But before we get to that, we'll start things with Mr. Q. Wallace. How are you?
Good, Governor. Thank
Good.
you.
Could you maybe just give a 30-second overview on the project and then we can open up the questions?
Happy to. Thank you. Good morning, everybody. For the record, James Q. Wallace, Executive Director of the Business Finance Authority. So this project is what you often see from us is a conduit bond. So it's a tax-exempt financing that involves no state guarantee, no state taxpayer money or use of state funds. What this is a $200 million senior housing project in Londonderry. It consists of 190 units of independent living and 40 additional units of supportive living for folks with memory care challenges. It's a great project. It's done by a group called Baldwin. It's down in Londonderry. They've done many other projects like this around New England. They're eligible for tax-exempt financing, primarily due to their status as a 501c3. Our job in this transaction really is just to say, are you actually a nonprofit? You are. Are you doing a project that's within your mission? They are, so you qualify for the lower rate being provided from their bank. And that's the project in a nutshell.
Great. Any questions from the council? Yeah, Councilor Kennedy.
So, thank you for your presentation. But I did have a question. It's a nonprofit. It's $200 million. It's a housing project, obviously expensive. Is this fairly a high amount as far as nonprofit requests for financing? I haven't seen one of this level before.
It is. I mean, a lot of nonprofits tend to be small, kind of niche, focused on a mission. They have operational budgets, whereas nonprofit housing groups tend to have requests much more like this. So, because building housing, especially 100 units, costs a lot, especially now. So I would say it's unusual for a nonprofit in general, but not unusual for a nonprofit involved in the housing market.
Okay, and the follow-up question would be, from a staffing standpoint, are they going to be able to staff it, and are they going to be able to house the staff?
They've done pretty well from a staffing perspective. They paid well. They've managed to keep COVID disruptions actually to a minimum, which is pretty important, particularly among this cohort. In fact, actually in their independent living units last year, they had 0 COVID cases in all of 2021, which is just pretty remarkable. And that helps keep staff you do have, at work.
And the reason why I mentioned that, Governor, is we had a piece of proposal the other day in Presidential Oaks in Concord, which some of their the actual housing units they use their incoming nurses for transitional housing for their staff. So when I look at a project like this, first thing I think is, are we going to be able to find a project for staff that are ensuring, take their facility? So that's why I asked the question.
I think it's a great question. They seem to have a pretty good plan for it. One thing, we weren't asked to apply on the project, but you add 230 units of housing into the community, and people move into those, that can free up 230 units of housing when people leave. So as we add more supply into the continuum, it helps little bit by little bit relieve the pressure kind of across the supply chains.
So this is one last question. So is this, it's a nonprofit, is it workforce housing? Is it low-income housing?
It's eligible, yeah, senior housing.
Okay. Again, your argument, I would argue, in that you need younger units for the workforce. So if the elderly are moving from out of state to elderly units in this part of the state of Southern New Hampshire, I'm not sure we're screening out apartments and housing for the younger workforce. So.
I totally agree with you. I would love more housing for the younger generation. I think all of the above, all of the above solutions maybe will be.
Okay, thank you.
Additional questions?
Governor?
Yes.
Councilor Stevens?
Thank you, Councilor. Go ahead.
Good morning, everyone. Mr. Wallace, again, thank you for speaking with me yesterday. For clarification, as a 501c3, this project is exempt from business profit taxes, correct?
I believe so. I believe that's correct. Not an accountant, but pretty sure.
And I just wanted to bring, and we discussed this yesterday, there were two typos on tab 3. Notification that they are a 501c3, and the construction cost is $130 million, not $130,000.
Yes, thank you, Councilor. That's correct.
And a follow-up, please. Mr. Wallace, I just want to congratulate you on bringing this project forward. They have taken a proactive approach to disease mitigation and to future outbreaks by their design. They have demonstrated an ability to segment their memory care into smaller pods. So they have done a stellar job throughout the pandemic. So well done.
Thank you, Councilor.
Thank you. Additional questions for Mr. Fuller? Okay, we'll take a brief pause on the questions, and I would just ask, as this is a public hearing, if anyone from the audience would like to speak specifically to this matter, please just raise your hand and come forward. Okay, seeing no takers, we will close the public portion, the public hearing portion of this item. Seeing no further questions from the council, I guess we'll move to a roll call vote.
Councilor Kenny?
Yes.
Councilor Williams? Yes. Councilor Stevens?
Yes.
Councilor Gafford?
Yes.
Councilor Wheeler?
Yes.
With that, the item is approved.
Thank you.
Thank you. So moving on, we have our first items from the Department of Health and Human Services. We ask for a motion to adopt agenda items 8 through 12 from the Department of Health and Human Services from the Office of the Commissioner, noting that item 7 has been withdrawn by the agency.
So moved.
Second.
Any questions on items 8 through 12? Councilor Kennedy.
Good morning.
We're going to have a few more that we're going to discuss here. But so these are instances where staff is somehow assaulted by residents. And so we've redacted their names. So and that's something many years ago, I know when Colin Van Osten was here myself, we really pushed for those things to be redacted. But I want to ask about the other information that's being redacted on these particular 3 instances. We're talking that there's sick pay or the length of time they're out and other things. So what is technically being redacted, or what's required to be redacted from this incident?
So the person's name and any information that could lead to the identification of the patient that was involved in the incident. Outside of that, I don't think there's anything else beyond that.
So is there, do we have a kind of an impact for each incident that proves?
In our workers' comp claims we do. So under workers' comp, they would have days lost of work cost, medical cost, time lost cost, those sorts of things. So we have that internally, but not in a public document.
Gotcha. And do we know when we have this type of instance, does it impact on staffing use in the city generally? Does it create some staffing issues?
It has always created staffing issues. The work at the inter-hospital is very high-risk work. It's fairly common to have some injuries there, but even if you go back 5 years, back when I was at the inter-hospital, we did a lot of work to reduce the amount of injuries that you see coming to governor and council, and it has reduced significantly over the years. But of course, anytime that you have an injury that is more than a day or two out, it's going to impact our staffing levels for sure. And usually we supplement that through overtime and temp staffing.
And my last question is, I noticed there was an incident in November, December, and January. You bring the governing council when there's a certain amount of instances, or how long does it take before one of these instances becomes before the council?
All incidences that have lost time from work come before the council because we pay them full pay instead of a workers' comp pay. Typically, it takes about 30 days. It really depends on the circumstances around the incident and whether it's deemed innocent. And that sometimes takes time to do the investigation. I think the November one was delayed somewhat coming to the council. December and January is within the time frame of when we typically see it.
Great, thank you. I just appreciate that update. Thank you.
Councilwoman?
Just a question on 11. I've had a number of calls about the selling of the test kits at liquor stores. First of all, how's it going? Secondly, the questions have been about what happens to the monies that are collected when the test kits are sold. They come back into the ARPA fund. Can you talk about what happens to those funds?
Yeah, so it comes back into the ARPA funds to be used for other COVID purposes, which would come before this council. So if for some reason we sell all 1 million tests and we feel like it's in the best interest of our state to buy additional tests, we would have to come back before council to re-spend that money. So that money, with the exception of the small admin fee, which is 5 cents per test, is going back into the ARPA funds.
I know when we approved this item, we didn't know for sure what the cost of the test kits was going to be. What is the cost?
$11.39 is the retail cost.
Thank you.
Councilor Katz?
Thank you. Do we effectively know what an expiration date we have on these kits?
We purchased them within 6 months, so it has to be at least 6 months before they expire. So that was part of the bid process when we purchased them. So anytime 6 months or after.
So anytime they expire, and we'll get an accounting of their
Waste.
expiration and...
Sure, we can do an accounting of waste if they expire on
Well, I
behalf of
wouldn't
the
call it
council.
waste. I mean, it's not your fault that they expired.
Yeah, we don't expect to have a lot that are not going to be sold before the expiration date, but we can certainly track that. We'll ask the weather commission to track it.
Well, there's so many free ones going out, I don't know if people are going to pay $11.39.
Yeah, there's definitely free ones, but oftentimes when you order those free ones, especially in the federal program, it takes several weeks to get. If you're symptomatic today, you're probably going to want to get a test today or tomorrow, and that it just is one more access point for people that want testing.
Thank you.
And just to be clear, these are reimbursable by people's insurance?
Yes.
Further discussion on any of these items? Okay. All in favor of items 8 through 12, please signify by saying aye. Council Stevens?
Aye.
Thank you. Any opposed? Hearing none, those items are approved. I'll now ask for motion to adopt agenda items 13 and 14 from the Department of Health and Human Services from the Division of Financial Services.
So moved.
So moved.
Any discussion?
I know that one of the previous meetings, we had asked about the number of dollars that were coming in for these various programs. And we were going to get an accounting of it, and I know that they've been very busy.
I have it for you, and I forgot to send it yesterday, so I will send it tonight.
Thank you.
You're very welcome.
What's the total? Do you know offhand?
I don't remember offhand,
All right,
but I will have it to you today.
thank you.
Thank you.
But it's a big number.
Yeah. it's a big-
Governor, I'm sure it's a huge number.
Yeah.
Right? Yeah, everybody gets it.
Yes, yeah.
And then we do that.
You want to see the number too?
What's that?
You want to see the number?
Of course I do.
All right.
Well, I just want to see what you see. That's more important. Oh, okay, that's the number that
So you can be ready for the next meeting?
Exactly. Questions on 13 or 14? Okay. Hearing none, all in favor of items 13 or 14, please signify by saying aye.
Aye.
Any opposed?
Aye.
Thank you, Councilor Stevens. No opposition. Items 13 and 14 are approved. I'll now ask for motion to adopt agenda item 15 to the Department of Health and Human Services from the Division of Medicaid Services.
So moved.
Thank you. Any discussion? On item 15. Okay, hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens? Any opposed?
Aye.
Thank you. Any opposed? Hearing none opposed, item 15 is approved. I'll now ask for a motion to adopt agenda items 16 and 17 from the Department of Health and Human Services from the Division of Economic and Housing Stability.
Second.
We have a motion and a second. Any discussion? Okay, hearing none, all in favor signify by saying aye.
Aye.
Councilor Stevens?
Aye.
Thank you. Any opposed? Those items are approved. I'll now ask for a motion to adopt agenda items 18 through 20 from the Department of Health and Human Services from the Division of Children, Youth, and Families.
So moved.
Any discussion? Oh, Councilor Hicks.
Governor, I don't know if you were going to give us an update on the Harmony case today, or...
Not the quick answer is not today. I know Joe Ripson and the team at DCYF have completed a significant portion of the internal, I don't know if we're calling it internal review, or I'm not sure the word they're using. The document, yeah. And I know that department has been working a little bit with the Department of Justice in terms of what can be released, and what we've always committed to is releasing every bit of information that we possibly can. I think we're probably, I don't need to put it on you, General, but I think we're hopefully getting close.
I think we're getting close.
We're getting close, hopefully. I think hopefully within the next week or so. Next week, there we go. I mean, we've been pushing real hard to get it out as fast as we can, so I think by next week we'll have something.
Thank you. And also in that report, I know that a few meetings back, we were told that the substantiability number is what was like 4 to 8% in the state of New Hampshire. The national one is somewhere around 18 to 22%. Why are we so low? And I only get that because I was watching this documentary called The Trials of Gabriel Hernandez. It was a case of a young boy in California. And there was a lot of similarities of what occurred. I would ask everybody to watch it. It's on Netflix. It's a 6-series part. And in there, they talked about a company called Maximus that I think we do business with in this state. And there were a lot of questions about that company in that documentary. So I would hope that we would take a look at it, report back to the next council meeting. If anything that happened in California is happening here.
Absolutely.
What's the documentary called?
Trials of Gabriel.
Trials of Gabriel. Okay, I'll have Joe Ripson pull our substantiated data compared to the national average, and we'll be able to report back.
Because it sounds like it's very low compared to what the national average is. And I can only tell you that be prepared when you watch that documentary. It is very gut-wrenching. I had a tough time getting through it. Also, if we could possibly get information, and I know the chief in Manchester is working hard, as the department is, to see if we can't find this number. Somebody has to know something. Passing the ball, or closing a case once somebody leaves and goes to another state, there's got to be communications, whether it's Massachusetts, Florida, or another state. Somebody has to know where that little person is. Because that's the most difficult, of all the things that have been talked about in this case, it's how for 2 years nobody's seen this little girl.
They're not.
I mean, Governor, I applaud you for certainly dropping a dime on the state of Massachusetts. Well, we have to drop a dime on every place that a child goes and what happens to them. And the department should be more concerned than probably I am, because they see an awful lot of kids that are out there. And I know that it's not an easy task, but we've got to find out what happens. Because I've gotten more phone calls about this situation from regional people than you possibly can imagine.
Okay. Any other questions on these items or anything pertaining to DCY? Okay, hearing none, all in favor of items 18 through 20, please signify by saying aye. Aye.
Aye.
Any opposed?
Aye.
Thank you, Councilor Stevens. Those items are approved. And we'll get something by the next meeting on those items.
Thank you, Governor. Can we, I know that we've got a tally for the amount of dollars. Are we going to keep a running tally? Because there's more in this, more in this.
So it's a very manual process to update it, so I think maybe quarterly is probably the most reasonable to update it. Trying to update it every time it's better to do it all at once.
But once you have it done, then you only have to add what's in the agenda.
Yeah, in theory. But it's just not like the time, from a time perspective, it makes more sense for somebody to sit down and do a chunk of work than it does to do 3 minutes of work every, it's just...
Well, okay, but...
but what quarter?
No, it's a very legitimate question.
Yeah.
So if we have 10 items here with 10 different dollar amounts, what aren't we seeing that would take more time other than just adding these dollar amounts together? Because that wouldn't take any time at all. So
But that's just adding to the budget, which that the LBA provides that document and does update that every meeting. What Councilor Hampus had asked for was spending. And so that
what's spent through on these contracts.
Correct.
Oh, I see.
And that's more time.
Okay. So if there's a $10 million contract, but we only spent $4.6 million, and that
Exactly,
number is
then we
going
have
to
to
fall
hold
separately.
invoices.
So you're only going to give us the spend and not not side by that, the amount of money that was expended. I think that's what the government...
Expended and approved. Spent and approved.
Correct.
Right.
So the approved, the LBA already maintains this on their website. Every time this item comes through G&C and fiscal, it gets added to that document. What you had asked for was extended. That takes more time to update.
Right. On that document that you're sending me, can you not only show expended, but what we approved?
Yes, possible. I actually took the
Side by
LBA.
side?
Yes, I took the LBA document and added to it, so that we didn't recreate a new document.
Okay.
Great.
I'll have to see it first.
Fair enough.
Do we get a 2021? Do we have I think I need a motion to adopt agenda items 20 and 21 from Division of Law Enforcement Services. Thank you. A motion. Do we have a second?
21 and 22?
Yes. Do we have a motion and a second? Any questions on items 21 and 22? Hearing none, all in favor signify by saying aye.
Aye.
Any opposed?
Aye.
Thank you, Councilor Stevens. That's an aye. And any opposed? None opposed. The items are approved. I'll now ask for a motion to adopt agenda items 23 through 33 from the Department of Health and Human Services and the Division of Public Health Services.
So
Is there a second? Thank you. Any question on any of these items? Councilor Wong.
Question on 24. This money is to address the incidence of COVID and STD in our state. I wonder if you could tell us a little bit about the status of STD incidents in our state since COVID. What are the initiatives to address that?
Yes, Patricia Kelly, Director of Public Health.
Good morning, Councilor. Good morning, Governor. Thank you. That's a great question. So I'll talk a little bit about this money and then talk a little bit about STDs in particular. So the funding that we get through here is for something called disease investigation specialists. And these are the folks who have cut their teeth on doing disease investigation for STDs historically, so for HIV, syphilis, gonorrhea. They are also trained in a way that they were our best resource when we started doing COVID investigations or investigations in other infectious diseases like tuberculosis. And so the funding source that we have comes through this particular line for folks to do a wide range of infectious disease investigation, contact tracing, and counseling. So your question around STDs is we've continued to see an uptick in STDs throughout the pandemic. And we are managing that closely. But this continues a trend that we've seen even prior to the pandemic in a number of those cases. So the funds in here will be used for Manchester and Nashua Health Departments, who have their own disease investigation specialists who are often public health nurses. They don't always have to be nurses, but they're often public health nurses. And they do their work in those two big cities. And then the state of New Hampshire, DPHS, does the work in the rest of the state.
And our family planning service providers are primary providers of STD diagnosis and treatment.
Absolutely, yes.
And we have not funded them since June of July 1 of last year, is that right?
We have not funded many of our family planning providers.
Providing the bulk of the services during an STD outbreak.
Yes.
Thank you.
Governor?
Yes.
Councilor Stevens? Item number 32, please. This contract, which is being awarded to JSI, they are to collaborate with prevention partners throughout the state. And one of the stakeholders and key contributors is the New Hampshire Center for Excellence to End Addiction, which is operated and managed by JSI. Hence, they have another contract. So my question is, though this was, bid out properly, was it taken into consideration that this vendor already has a contract doing similar work?
Thank you, Councilor Stevens. This is Patricia Tilley. So in our procurement process, there's certainly the capacity section of any procurement, and the fact that JSI has a long history in working in the space around tobacco prevention, vaping prevention, as well as substance misuse is certainly to their benefit.
A follow-up?
Yeah, of course. Thank you.
But again, for perspective, I mean, it's weighing heavily on this one vendor, their viewpoint.
Again, the bid was put out as a competitive bid. It was open. I don't have off the top of my head how many other bidders were there. I can probably take a peek in the letter to be sure. But they have been a long-term partner with the state of New Hampshire, doing a variety of our tobacco prevention work for many, many years. But we do procure it and do a competitive bid to see if there's anyone else out in the field who would also be interested. Four bidders. Thank you.
Follow-up?
Yep, sure. Councilor, go ahead.
Was there any consideration or discussion that, again, they had a contract with a stakeholder group which is very much involved with this matter.
Again, I think that that speaks to their capacity and their ability to perform on this particular item, which is this mass media campaign that's specifically aimed at youth. They have a track record in this area, and therefore, I think as we went through the competitive procurement, they landed up on top.
Sorry, I don't mean to speak for your council students, but he's saying that given their experience in other areas of the state, that would have helped their experiential score, per se.
Yes.
I see. Okay. I don't know if that helps, council students.
Yeah, I just want to make sure that it was, there was some discussion that it was highlighted, or at least noted.
Yes.
Great. Thank you. Councilor Kenny?
Thank you, Governor. So, Agenda 25, radon discussion. So EPA is giving us some money. Public health will oversee our program here in the state of New Hampshire. And I'm just wondering, what is our program? What does it do? And is there a radon problem in New Hampshire? And do we coordinate with the real estate association on that finding?
Sure, absolutely. Thanks. That's a great question. So these are relatively new funds that have been added to our portfolio, that new federal funds for radon. Radon is the second leading cause of lung cancer among individuals, and we certainly know in New Hampshire, given that we are the granite state, that there is a radon issue throughout the state. What these funds help us to do is actually purchase free radon tests for individuals. Anyone can go online right now and order a free radon test that they can test within their home. And it's an air radon test, and then get those results back to them so that folks can do the mitigation that they need within their homes. We've had a long relationship with real estate because we know the impact of property values, but it's very important for families to understand what the risks are in their home and be able to take the mitigation steps necessary.
So just to follow up, so you can basically go online to the department's website and get a free kit sent to your house?
Correct.
Okay, because I read their basement, so.
Then get online right after this meeting. We'll get you hooked up.
No, it's a topic that goes unnoticed,
Yes.
but it does impact people in the house.
Anybody that's tried to buy a house in the state understands that it is one of the big items. When I've been house hunting, the radon levels and whether a house has mitigation and where it's located is a big deal.
It's a very big deal. This really is a preventative thing that we can do, knowing that it's the contribute, how it contributes to lung cancer.
Right. Thank you.
You're welcome. We're happy to do it.
Councilor Gatsas?
On a separate issue, Governor, yesterday's paper, AMR's report on the number of overdose deaths is climbing in the state of New Hampshire. I know we just had this.
Speaking of that, I think it was overdoses. Yeah.
Overdose.
Yeah, not the deaths.
Not the deaths,
But the
just
overdoses,
overdoses.
yeah.
Well, that's climbing also. And the fentanyl situation is just getting worse and worse and worse. And coming from across the border, and I don't know how before it gets in the state of New Hampshire, but it's bad. And we've got to do something to protect the people that are having the problem.
Councilor Wheeler?
Yeah, on item 33, inside the item it says that there are new CDC requirements for the web-based immunization information system.
Yes, so thank you for that question. I am not aware of any additional new requirements. These are just the ongoing requirements from that we've been working with in terms of our immunization information system. We have worked through the data requirements that New Hampshire asked. They're actually fewer than what CDC asked for. We whittled it down to the very basics that we can provide for them. I can provide you after this meeting a list of the data elements.
That would be good. I didn't know new was kind of relevant, so I'm trying to figure that out.
Just back on that. So the legislature has legislation in to look at the opt-out provision with regards to permission for the immunization registry. Has the department taken an official viewpoint on that legislation?
I don't believe that we've taken an official. We would like to leave it as an opt-out. If the elected body chooses to move it to an opt-in, it's still something we could work with. Not ideal, but something we can work with.
I thought the sentiments, at least earlier last year, when we had some robust discussions about the topic, the council was preferring kind of an opt-in.
In our resolution.
Right. So,
And it's, the fact that it's opt-out right now, it was in statute. So if they choose to change it to an opt-in, it's something that we will work towards making an opt-in. Ideally, from a public health standpoint, opt-out is a better way of doing it, but we'll make it work.
Okay, appreciate that.
I think states that have tried, I think one of the things that's being debated is that states like Texas that have tried opt-in had to switch to opt-out because they couldn't get, it became futile, right? Because too many folks weren't opting in, how you opted in became complicated and all that. So I think that's one of the things they're debating is the system, it can work. I mean,
It can work, but the database is only as good as the data that's put in it. And if you have 50% of the population not opting in versus opting out, the database isn't comprehensive, so it's not issues.
And the other component that we've discussed in the legislature is the financial impact to the healthcare providers. So it may not be a financial impact to the Department of Health and Human Services, but a healthcare provider who has to continually provide an opportunity and have it documented just creates another barrier and just another opportunity for really just additional cost and work. And that is what we saw in Texas. They did an evaluation where an opt-out system costs about 30 cents per kid in order to implement. An opt-in costs about $2.50 to a kid to implement. It's just a cost and a consideration.
New Hampshire being a smaller state, a state that looked at it, I say that appreciates its privacy rights, and having gone down through our ID legislation many years ago, the privacy is very important to the New Hampshire resident. My wife is a privacy medical record, so it's very important for a lot of New Hampshire folks.
We're happy to work with the legislature and the policymakers in order to come up with something that works best for not only public health, which is important, but also the healthcare providers who have to implement it.
Okay, thank you.
Dr. Warwick?
So note on 33, and I've heard your reports before that you struggled with the accuracy of the COVID vaccine reporting. Will this help with that? And can you tell us what the status of that is? Right
So
now?
this is part of the funding that was back in September, October, November to get all of our providers on the HL7 and connected directly, their health records connected directly to the HR or the IIS. Will it help? Absolutely, especially with small kids coming on board in the next couple of months, from 6 months to 4 years. We expect that the vast majority of small children that are going to get vaccinated will get vaccinated in their pediatrician's office or their family practice office. We won't be doing small things like that through our vaccination sites. So if we don't have those HL7 connections, you're going to be looking at providers that need to do double entry every single time, which is just very burdensome time-wise. So this is what's going to help that for sure. I think we still have months to catch up on the time lost through the summer and the fall when we didn't have all those connections made. The pharmacies are on board now with reporting directly to us, but every individual provider we're now doing the catch-up with.
And that delay was due to the funding delay?
Yes.
Because it was on those discounts as well.
And physical, yes.
And also, on 28, with respect to harm reduction, talking here about some of the training that's being done for harm reduction, it doesn't mention training around the use of naloxone or fentanyl testers. I know some states limit the use of testers. I don't think that we do here in New Hampshire, fentanyl testers. I'm wondering if there is training around harm reduction related to the use of fentanyl testers and naloxone.
Thank you. I can get more information on this. For this particular item is to do a lot of our support with the provider community in particular. So this isn't necessarily training to individuals out in the field to ensure that providers have all the information that they need in order to work with their patients. And so I believe that's probably, but I can't speak to it exactly right now.
Okay, hearing none, all in favor of these items, please signify by saying aye. Any opposed?
Aye.
Thank you, Councilor. Hearing none, the items are approved. I'll now ask for a motion to adopt agenda items 34 through 39 for the Department of Health and Human Services and the Division of Behavioral Health. Second. Any discussion?
Discussion on these items. Well, I'm going to ask a question about Maximus. Would you provide a list for the council of the contracts that they're under and what they're for? For Maximus, please? Thank you.
Second.
Councilor Stevens?
Item 39.
Okay, there's a question on item 39.
Good morning, Asta. My question is, the housing voucher, is it true that it has been set at $715 per month since August of 2019?
So, good morning, Councilor. Patsy Fox from the Division for Behavioral Health. The amount that is an increase, actually, over a few years ago, it does seem very paltry at this point in time. The idea of the Housing Resuscity Program is that it is like a fee scale, and so there are contributions from individuals who have the vouchers or have the actual stock. What we do is we know that, especially in your region, that the rentals are so much higher than that. So we have a waiver process by which an individual can apply to have that amount waived so that they can have an increase. But we know it's low. This was not established in these times, and so it's going to continue to be a struggle, and we'll continue to look at funding to support those individuals who are eligible for these services.
Thank you. Follow-up?
Yeah, please.
And that potential increase, is it limited to $250?
The $250, I believe, is the cash amount that we use to support them, and it's in addition to the monthly rental.
Thank you.
Councilor?
So what you're saying is that the fee for the rental is $700 and...
It's whatever's in that amount, so it's $720, somewhere around there is what we provide as a subsidy for their housing. These are individuals who are eligible for Section 8, and they're waiting for their Section 8 voucher to be available, so they are deemed eligible, but then they have to wait for that to become available. So we bridge the time, and yes, I can see your face. So it is. It's about $720 a month that we provide.
Are there any people that you helped in the $720 a month payment to be able to get housing? Because I'd like to know where.
Again, they help contribute, so it's a cost sharing, and it's based on a sliding fee scale. And we have over 450 people who are on this program.
Almost everybody that discharges from the Hampshire Hospital into an apartment end up on this program. And they often have other supplemental incomes, such as Social Security, that will pay for the other portion of the rent.
How does the rental assistance, federal rental assistance program that we've been running for years, so they match?
We need Chris for that.
Sorry.
The Chris Santinello, Associate Commissioner. I do think New Hampshire Housing Finance is here, if there is questions, but is it the...
So we're just asking, because it's a bridge program,
Right.
often the individual provides some of the housing themselves. Can they also apply to the rental assistance program to provide the match to the bridge subsidy?
I would...
I think so, but I
I
don't
would
know.
think my gut would say yes, but I really want NIFA because I know there's a lot of federal rules on that. Because it's not federal dollars, it's general funds, and actually, you could use, if it's allowable, I would use those funds and not touch the bridge, and then use the bridge after that.
Right. Because if that's the case, you'd want to push everybody under the graduate assistance program and effectively not touch the bridge money, I would
Right.
think.
And we're also working closely with our continuum of care funds and the Bureau of Behavioral Health to really maximize all of the federal dollars before we use the bridge dollars.
So maybe not for this meeting, but maybe if you guys could dig in a little bit about how that works. And again, when someone comes to be part of the bridge program, our first response should be, well, we also have this rental assistance program, we get everything paid for, whatever. So, and how we're making those two programs either match or one kind of subordinate to the other.
Yeah, I mean, I know the CAP agencies are looking at, when somebody comes in and agencies and case managers are looking at all options, and everybody is pushing the rental assistance program for dollars, and and we also look really closely to it what other federal dollars.
Just sounds like in these times, I don't know when anybody's getting housing at those amounts.
It's not meant to cover your entire rent. It's meant to be just a subsidy.
I understand, but even with a subsidy, it's still going to be tough in the city of Manchester to find something. Out of those 400 people, can you tell me how many of them are from Nashua and Manchester?
We can get that breakdown for you. I don't have it here.
Councilor James?
So it's a submission to my ears because I'm working with someone right now who's predicted a 4-month extension. The question I have is, they found housing, but it's going to take a while for them to remodel the apartments. So is there dislocation fees for them to stay in the hotel, good storage while they transition into the apartment?
Is this the person that we talked about? I do know that our staff are working really closely with the city of Rochester, I think it is, to figure out options for this individual. Between, using different funding streams again, the staff working with individuals are really adept at trying to maximize all of the different pots of funding to help this person. So I know we're working very closely with the CAP agency, the city, and then other programs out there.
So just to follow up to that, it's found a place where you can move to, which is thanks to another district counselor, which is New Hampshire, the Southern Services provided the apartment. But we were talking about subsidizing something. Right. I thought the person and other people would need to wait out a transition period before that apartment unit becomes available. So they say, well, they're going to stay in a hotel. Are they going to, where are they going to put their items that they currently have in storage? And then their programs, rental assistance necessarily.
Rental assistance will pay.
They'll pay for that as well from that.
As long as it's tied to the individual.
Okay, great.
And then they're really good at that.
Okay, thank you.
Additional questions on any of these items? Okay, all in favor of items 34 through 39, please signify by saying aye. Councilor Stevens?
Aye.
Thank you. Any opposed? With that, those items are approved. We do have one late item from the Department of Health and Human Services from the Office of the Commissioner. Could I get a motion to adopt late item A from the HHS? There's a motion and a second. Any discussion on this item?
Just to thank you for being proactive and pushing this, along because, hospitals and needs and senior executives and supporting passengers to get this very senior stuff in mind about mental health population.
We want to make sure that the leadership team is tied to the entire system, not just that one building, so that we're taking care of the system, not just people in the building. So it's important to have state leadership in there.
Councilor Gassis?
Thank you, Governor. Are these numbers enough for leadership?
No?
Nothing's ever enough.
So you'll be back to this?
No, I mean, this is what we're allocated the salaries for leadership. And so if you look at a CEO making 165, a comparable CEO in private sector is probably making 3 times as much. So yes, is it high enough? No, but I don't think there's anything we can do within the state system.
We're constrained within our system.
I know that's because we're bringing them into the system. If we left them outside the system, that would make no sense.
Which is what we're doing for the majority of the operations of that hospital. It's what we do. We have to go that way for the physicians at New Hampshire Hospital because we do not have a pay scale to support the physicians at New Hampshire Hospital. That's why they work for Dartmouth. And this is for 2 years, and we have to evaluate over the next 2 years what we're leaving in, what we're taking out. But it's really important that the hospital is connected to the rest of the system. The CEO and the leadership team needs to not just manage the hospital, but they need to manage the needs of children's behavioral health across the state. So it's not just about what's going on in their hospital, and it does make a difference. You know, when I was at New Hampshire Hospital, looking at the wait list, you can very easily say, I'm responsible for these 160 patients, or I'm responsible for this 160 patients and all these people in the ER. And I want the state leadership to be responsible for the system. So that's why we're doing this initially, and then we're going to put it out to bid this year for subsequent years, and we're going to evaluate over the next 2 years what we're leaving in as state employees and what we're taking out. It does handicap us when it comes to attracting really good leadership into a hospital when our salaries are 50%, 30% of what the market is.
Sounds like we're going to be short.
Always short. At that level and at that level of expertise. As you said, same issue at New Hampshire Hospital. Those folks are making a lot more money than CEOs of other hospitals. But don't say that too loudly. I don't want the commissioner to know.
It would be a shame that we go through this purchase and we don't have the bodies there to take care of the folks.
We'll have bodies there. We have enough rising stars that even at New Hampshire Hospital, there are people that we attract there that they stay for several years, and it's a stepping stone into something that's more financially lucrative. And that's okay. We've had 2 CFOs come through New Hampshire Hospital, both shining stars that go on to private healthcare that make a lot more money, but they help us tremendously while they're there. We have a very committed staff at Hampstead Hospital right now that have worked for Hampstead for decades. Some of them will be asking to come on the state side, and this wage is comparable or more than what they're making on our Hampstead Hospital right now.
One of the interesting things we're already seeing is because the state is making all these different types of investments in mental health, with Hampstead, looking at these other hospitals that we're looking to invest in, we're seeing folks actually come this way across the border for the first time. Because people want to be where if the state's making investments, they're committed, they're standing behind those investments. Not that it's going to be easy. Everyone's going to have a workforce challenge, to be sure. But we are definitely much more attractive than most any other place in the Northeast right now in terms of mental health, because they know that we're not diddling around. We're really making solid investments here for the long term, which makes us attractive for the expertise that we're looking for. It's kind of interesting.
I understand that, but when they get that there are 28 adults and 3 children waiting in emergency rooms,
We need more inpatient hospital
We
beds.
need inpatient hospital beds, not just Hampstead. That's why we're looking at these other
Hampstead's
hospitals.
45 right now. We're going to grow beyond that once we get in there and we start investing in the staff. But after all of the investments we've made in both community-based care and crisis-based care, we need additional inpatient-based care, not just for adults, for kids. Hopefully you'll see an agenda item coming in the future that adds additional children's beds in our state. We need options for our citizens so that they can choose where they want to receive their care. We shouldn't have just one option. So those are the things we are trying to bring forward. There is also the option for community-based crisis care, which is very important, which we stood up, the rapid response for kids, mobile crisis for kids, all options depending on what the needs of the child is. So I think that we've spent 5 years investing in community and crisis-based care. There will be proposals coming forward in addition to Hampstead to increase the inpatient capacity in our state. We need that. Both kids and adults. It's the only way those numbers are going to get to zero. And those numbers that you're seeing are those that are involuntary. You can double that number for those that are voluntarily waiting for a voluntary bed. So the burden on the ER in the system is even more than what you're seeing.
I just hope that we don't see another incident that happened some 10 years ago at the Elliott, the disaster that happened there.
We completely agree. That's why we're bringing forward proposals to increase our inpatient capacity. And, the proposals we're bringing forward are public-private partnerships, which is the best type of proposal. The most expensive people to run a hospital is the state. New Hampshire Hospital does a great job, but, the cost of our employees and our wages and our benefits makes it more expensive to run a state-run hospital than a private-run hospital. That's why we're looking for public-private partnerships, to invest in the infrastructure, but let them run it efficiently and with the quality that they are known to run across the country or across the state.
And if I may, to your point, when you have these public-private partnerships, the private entities can bring in the best of the best, right? Because they can pay the best of the best, and that's why we become kind of a center of excellence, if you will, when you put all these different types of models together.
Well, let's see if we can't find a public-private partnership in the city of Manchester.
We can.
Oh, yeah.
We can. We will have that proposal coming forward, too.
It's coming.
We can.
Yes, we already have found that partnership, without a doubt. But we need to be able to bring it forward and get the support. By us investing in, yes, can these hospitals or these entities build a psychiatric wing or a hospital? Yes. But by the state investing in it, we then have say. We have leverage. We can say New Hampshire residents come first. We can say involuntary patients come first. We have that leverage once we invest in these projects. And that's what we're trying to get.
Well, as a council, I'd like to see those stipulations in the contract that comes before us, before the contract comes before us to do it. Because that's what's most important.
I agree, Councilor. The items that I'm trying to bring forward are accept and expend federal dollars. I can't even get to negotiations until I'm funded. So the item that continually gets withdrawn from the council is just accepted and expended federal funds. That gives me the ability to get at the table and negotiate with these health systems all the stipulations we're talking about. The contract will then come back to the council, and you can look at the scope and at the stipulations that we put in. But I can't even get to the negotiation table if I'm not funded.
I understand, but the council can't make any changes to any contract. We can only say up or down.
Right. And we
So we'd
had,
like to have some input.
so we had sessions last week with all the council members, and we took input from everybody. I've had personal conversations with people about what's really important to have in the contract from the state side. Things like priority of New Hampshire residents, involuntary, a certain Medicaid census to make sure that they're not just catering to the private pay. We're ready to go and negotiate those things. I just need to be able to get to the table.
Councilor.
So can you just clarify this for me? My understanding is once you enter into negotiations, then all communication with the council stops during the negotiating period.
Once we start negotiating, we have not started negotiating.
Because you can't start negotiating.
Because I'm not funded, yes.
So this would be the time now when we could have input and conversation, discussion.
Yes.
This would be the time where if we want stakeholders engaged, if we want public input, if we could ask for this, this is our chance to have a conversation.
So
I really encourage the department to really engage in that open dialogue. Thank you for the session this week. We're just hearing, as I hear it from HCA, you've been in those conversations since last May. And we're just hearing about it for the first time. And I think there's a lot of information that to take in here and to communicate. And this is our opportunity to do it, not after we approve an item to accept it.
Now, and yes, to have input into what goes into the stipulations, I agree. We have been talking about this for a while. Even Commissioner Myers talked about this. One of the reasons he talked about doing an IMD waiver, which I've said over and over again, is to attract private providers to our state. That was the intent of filing that waiver, which will be approved for July 1. Based on everything we're hearing from CMS. So we've been talking about it for years. 5 years ago, there was a different national company that Commissioner Myers and I met with to talk about bringing them to the state. Absolutely. So you should have letters coming from the Behavioral Health Association that is completely supportive of standing up inpatient capacity, the Hospital Association, the Department of Insurance did a review. I mean, all of those stakeholders, we've talked about not a specific vendor, but the concept of bringing a private provider to the state for 40 years. This was our first opportunity to bring it to the goal line, and that's where it's standing right now, is at the goal line. It's not crossed, it's just standing at it.
And if I may, there's only so many folks that can do this, because we're not, on the investments that we're talking about, we're not doing the investment. We're just taking some of the financial edge off, if you will. We're buying, if you will, our say into that process, because when we make the investment, we now can have leverage on that. They're still providing tens and tens of millions of dollars. So it's not like there are only so many groups that are actually willing to do this at this time. So
we've been pleading with providers to do it for 5 years. I mean, this is just the opportunity we have with the federal funding to invest in our infrastructure.
And if I may, one of the previous providers that Commissioner Myers and myself, and I know you were a commissioner at the time, but I know deputy commissioner at the time, I can't remember the title, were involved with. One of the issues wasn't just, okay, well, this is our capacity, this is our need. They have other options to take their money somewhere else. It isn't like this money is going to be here and we can wait around. They're going to make this investment with this cash somewhere in this country. So either you kind of grab it while you can, or you lose the opportunity. And when we're talking about the investments we're not talking about programming for 2 or 3 years. We're talking about infrastructure investments that will literally last 50 or 100 years in this state. Right? If you were to build a new hospital, that ain't going away. They're not picking up and moving that. So once you plant your stake in the ground with that infrastructure, once they pour that concrete, so to say, they're here, or the facility is here. And that's something that I'm very concerned folks are just going to take their dollars and put them somewhere else. And if they can move faster and get a return on that, they're going to do it. And then we just kind of miss out. So we haven't missed the opportunity yet. I think that's safe to say. But we don't have all the time in the world. Eventually, these dollars will potentially walk away. And again, it's tens and tens of millions of dollars. And the commitment to bring their workforce expertise as well. Right? Because now they're on the hook to staff it. And actually make it there. And that's the number one issue we have in this state is workforce. So by bringing those public-private partnerships guarantees the level of workforce that the state cannot and would never be able to provide in this day and age.
What you've seen come forward is one of 2 projects that we will bring forward. There will be a second one that will come in the next 30 to 45 days.
So while we're discussing the contract that we're using today, my issue really is with the breaking of the capital costs. Because we have every program on this side in this state, okay, that requires over $500,000 a 20-year commitment. That particular mission of that nonprofit and the money that goes into it from the state remains that mission for 20 years. And if you go to look at the stewardship for 20 years, you can go to Community Development Block Grant. It's a 20-year commitment for that, that building and that mission statement and that nonprofit and the services that they provide. And in my head, I'm trying to figure out how can I explain this to the taxpayers that the $15 million is not going to the Business Finance Authority for a request, or low-interest loan, or going to New Hampshire Rural Development or something. They're actually getting a grant for $15 million with a 7-year commitment when every other program under the sun is a 20-year commitment. How do we know after 7 years they don't walk out of the state? And when you don't have insurances within that building, that capital context, that we are owner of that building. So that's where I have a problem.
Dean Carucci is looking at that, and HCA is looking at that to do an extension to 10 or 12 years after having that conversation with you. The big issue is that we don't want their commitment to run behavioral health units, specifically children, adults, eating disorder, co-occurring, partial hospitalization. We don't want empty units 6, 7, 8, 10 years from now because the need is no longer there, but because they're contracted with the state, they can't do anything else with the unit. So we know that community needs change on a regular basis. So if we tell them for the next 20 years, this needs to be a psychiatric hospital, and our community-based programs and our crisis-based programs hits it out of the park, and the need for inpatient beds drop. That's what we want, right? The need to drop. And so they're sitting with, let's say, 20 beds that are closed, but they can't do anything else with those beds because they're contracted to us to only do behavioral health. So the reason why it's 7 to 10 years, which is what we're looking at, is that we want them to do what the community needs, not necessarily what a state contract says.
So this is a follow-up. I would say that 7 or 8 years from now, we can modify the contract with a different council, but somehow that we still have a leg in that facility with a financial interest from the state that says we're still bonded together, you know, the gift that you providing a service to the state that you originally intended to. We realize 7, 8 years down the road, there might be a shift and we have to go into another direction based off the state priorities. But if you just give someone $15 million and they go bankrupt, and you don't have a building, you don't have the services, the Attorney General can't go back after that nonprofit assets to say we have an interest. It's not in this contract.
I think there's no contract being provided right now. That's the point, right? Is that I haven't brought a contract forward because I can't get to the point of negotiation. The Attorney General's office is going to have to weigh in on the legalities of what we negotiate when there is a contract, and I am sure they are going to put the safeguards in place to make sure that we have investment going forward. I think one of the things that we'll probably talk to HCA about is having a 7-year commitment and then a 7-year option to renew that commitment. That way you have a renewal every 7 years and then for an additional 7 years. That way, if there are changes to be made, that we can make that at the renewal period.
So if we pass and authorize you $50 million, that doesn't mean when it comes back in the form of a contract, if the contract is even agreed to at the other end.
We may get to the table, we may never get to an
The
agreement.
dollars would never be expended.
Yes, yeah, we may get to the table, and HCA and the department may never get to an agreement. And then nothing's going to come back and the money's not going to be spent. But
So you'll still have time to say.
yes, if I bring back a contract that you don't like, then you can turn it down and say, go do better.
Right.
Okay.
But again, we'll have time. We have a couple more weeks to go down. Councilor.
Thank you, Governor. Is there a reason why we wouldn't bring the private sector to your table and negotiate with a multi-million-dollar company and knowing what the business discussions would be? I think having some of those people at the table with you to protect you on the financial side would make an awful lot of sense.
I
Because
don't
I'm sure
know
that
if we're allowed to have outside people negotiate for the state.
Yeah.
I don't know. Maybe
That's kind of where we lean on the expertise of the
Attorney
Attorney General's office.
the, right.
Yeah, but the Attorney General's office are lawyers. Please, I wouldn't have had them negotiate contracts for me.
I mean, we could talk about how to do that.
I mean, I'd have you look at the contract once I've done, I'm finished negotiating. But I would think that you'd find some people in the private sector that understand how to protect your backside from some of these big companies.
We can certainly hire a consultant. I mean,
I'm sure you could find people in the business section of the state that would come forward and do it for nothing and not a consultant basis.
Yeah, but you got to be careful because then it could be, you don't want to break, you don't want your potential competitors or something like that, negotiating the contract. But we could maybe find somebody with that expertise.
Yeah, we can certainly, we can think of ways to do that.
Good idea.
Okay.
Yeah, hold on,
Did we?
no, we haven't even got to that. So, further questions on whatever topics you like, or items on. Okay. Hearing no further discussion, all in favor of late item A, please signify by saying aye. Aye. Late item A is